The saying, "an ounce of prevention is worth a pound of cure" by Benjamin Franklin, is a very important saying that we can apply to workplace violence today in our healthcare settings. Effective communication is something that can be worth part of that ounce in our prevention of workplace violence. A simple update on a plan of care to a patient and to the family can keep them from becoming aggressive or hostile towards us as nurses or as healthcare providers. The National Institute of Occupational Safety and Health in 2019 defines workplace violence as, quote, violent acts including physical assaults and threats of assaults directed towards persons at work or on duty, end quote. Emergency Nurses Association, or the ENA, in 2014 published a position statement about workplace violence stating, quote, the violence can manifest in environment, in emotional or verbal abuse, coercive or threatening behavior, and physical assault. Acts of violence can also cause physical and or emotional harm to emergency nurses as well as the patients for whom they provide care, end quote. The position statement also goes on to explain that workplace violence is 3.8 times higher in the healthcare setting than in any other private industry today. The Journal of Emergency Nursing and the position statement that the Emergency Nurse Association puts out, as well as several other resources, states that a lot of workplace violence goes unreported and gives a number of reasons for that. One is the lack of policies in the facility, fear of repercussions in reporting, lack of physical injury, so they don't bother reporting it. It's the culture of I signed up for the job, and also the cumbersome reporting mechanisms that facility has put in place for them. As in an article in the MedSurg Nursing Journal by Thompson, Galecki, and Plummer, it states, quote, aggression and violence expressed by patients may be the result of frustration, fear, or anxiety about their care, and may or may not be associated with mental illness. Workplace violence will rear its ugly head in any occasion, and a lot of times it is because of mental illness, drug intoxication, drug overdoses, mentally incompetent people, those with mental handicaps, or also medication reactions from medications that the patient is receiving. But other times there are incidences where mentally competent patients that are normally wonderful people to work with become aggressive, become hostile because of the situation or the care that they're receiving, or they believe that they're not receiving, and they feel like they're being neglected in the healthcare setting, especially in an emergency room setting where nurses rush in, they do their work, they pull their labs, they do their x-rays, and then we disappear for a number of hours sometimes, waiting for people to care for us and waiting for those test results to come back. And so we don't check in on the patient again. Effective rounding and an effective plan of care for people, updates of plan of care, can prevent those patients from becoming hostile or aggressive, and family members as well. One area to be researched and explored in the presentation of workplace violence, the ENA states in their position statement a need for increased emphasis in training nurses to recognize patient cues to discern potentially risky situations and advise concentrated efforts with a focus of workplace violence prevention rather than managing incidences and the sequelae of workplace violence, end quote. De-escalation techniques have been implemented in our facilities and hospitals for about 4 or 5 years now that have become mandatory in those trainings. But we don't spend a lot of time in preventing those incidences. We just work on the de-escalation tactics of those incidences. The Alice Training Institute in 2015 stated on their website, gave a education about preventing workplace violence. This institution thrives on hostile environments and teaching and educating healthcare providers and those in the workplace and other people in the workplace on de-escalation techniques from customers, patients, things like that, and active shootings as well. In their list of things that you can do to prevent workplace violence. Number 2 on the list, end quote, is create an effective line of communication. So it's very interesting that a company that thrives on hostile environments and de-escalation techniques also is working on educating people to prevent those workplace violence situations instead. And one of the top priority of that list is effective communication. In a 2009 article by Patel, Fielden, and Meyer and Albert in the Journal of Emergency Nursing, it asked patients and nurses what their priorities were in communication. And surprisingly, patients ranked 3 things as their top priority, in their top priority, which ranked up pretty high there. And those 3 things were, quote, nurses keep you informed about what tests and treatments are being done. 2, nurses use terms you can understand. And 3, nurses show you respect. Those things were the ranked lower on the nurse's scale than on the patient's scale. So effective communication is very vital in our process there. In the 2012 book, Crucial Communications, Tools for Talking When Stakes Are High, the authors Patterson, Greenme, and Macmillan, and Schweitzer thought that when we need to have those crucial conversations with the patients, we need to, quote, skilled people begin high-risk discussions with the right motive, and they stay focused on no matter what happens, quote, end quote. It talks about maintain a dialogue with the patient and what the patient needs for you and what the patient wants for themselves as well, and in the relationship there. So to keep the dialogue flowing. Effective communication at regular intervals can help a patient or a family member from becoming angry or hostile in those situations. We must educate ourselves on all facets of effective communication, and effective communication can help prevent hostile environments, and it can be used by anybody in any level of profession, from techs to CNAs to housekeeping, all the way to the nurses and providers. It's better to become a hero and prevent the workplace violence than to become a victim in the workplace violence and have those issues for generations to come.